Hi, Dr. Kenneth Hughes in Los Angeles. I'm a plastic surgeon here in the area. I wanted to start a series of kind of plastic surgery education short videos to explain to patients about the various procedures. So in this time of the COVID, everybody should be wearing their mask. I have multiple kind of preventative measures in place in my surgery center to help prevent things, but these are kind of a nuisance, and you can see they're destroying my face here, but they are vital to kind of stemming the spread. So I will talk about various procedures. Like I said, one of the most common procedures performed in this country is liposuction. Liposuction is a procedure in which fat is removed from various areas of the body through a vacuum liposuction apparatus. The fat is essentially avulsed from the underlying connective tendrils from the skin to the underlying muscle fascia, and it's in the space that you produce the results. About 400,000 liposuction procedures are performed each year by board-certified plastic surgeons. I probably perform several hundred a year. Most of those are liposuction revisions in which a patient has gone somewhere else and then has come to me to sort of ask to improve the area. So what are key components about liposuction? Number one is the liposuction is done through several small portals. Some plastic surgeons use multiple portals for areas that I may only use one incision. Okay, so for instance, I'll give you an example. On the abdomen, I use 2 incisions in the pubic area, one in the belly button. I don't really make any incisions on the abdomen proper. Thus, it's much more difficult to tell that someone has had liposuction, period. The argument for making more incisions is that you can get to the areas more easily, and that's a perfectly justified argument. It's just that patients do not want a surgical look, and so I try to do it with the incisions hidden and to make fewer incisions. So the most common liposuction procedure performed is probably liposuction of the abdomen, sides, lower back, and bra roll. And this is typically referred to as liposuction 360 or lipo 360. Just means that you're liposuctioning circumferentially around the waist to give you the smallest waist and the best waist to hip ratio. So how do you ensure that the liposuction is smooth? This is a technique-dependent enterprise determined solely by the surgeon. So when you're performing the procedure, you are basically touching the liposuction flap, kind of grasping it with one hand, and then liposuctioning it with the other, in which you have the cannula. So this is a process almost like playing a violin, in which you are reducing, serially reducing that flap. And how you reduce that flap and the uniformity of that flap determines the smoothness of the result. By the same logic, the more fat you remove, the more dramatic the result, period. It's also just not about removing fat. It's about removing the fat evenly and removing the fat so that everything rests precisely when you're trying to heal. That will reduce the risk for fluid collections and poor results. So these are surgeon-dependent things that matter absolutely none what you are using, okay? So there are various things that are marketed. Laser liposuction in all different forms of that, ultrasonic liposuction, power-assisted liposuction, that just makes the surgery supposedly easier for the plastic surgeon. I just use the conventional cannula, tumescent liposuction. I found that has optimal control for me. So we've talked about a little bit about the procedure, how it's performed, etc. There are a multitude of areas on which you can perform it. You can do the arms, inner thighs, lateral thighs, posterior thighs, the buttock, the calves, the ankles, under the chin. You can utilize it for so many areas of the body where there may be some lipodystrophy. The other question you should probably concern yourself is, how do I determine who's the best liposuction surgeon for me? What you're looking for is the liposuction surgeon who can get that highest probability chance of success for that individual. So look at before and after pictures. Look at patients who may look like you. No one is exactly the same, but it will give you an idea of the skill level of the surgeon. Also look at videos. Videos can't really be photoshopped very easily, and so that gives you an idea of what kinds of skills the plastic surgeon has, how many liposuction revisions, whether or not he does it in combination with other things to improve existing deformities, etc. This is the first part of this series on liposuction. I will continue the next with the explanation of tummy tuck and how do you select a tummy tuck surgeon.